I'm alive.
Good evening, everybody. It's really lovely for you to join us. Just going to wait a couple of seconds for a few more people to join us as we are waiting for people to come through the link. My name's Nikki Lacey. I am the midwifery, one of the midwifery lecturers at Cardiff University, and I'm the admissions tutor for the BMid programme. I'll let my lovely colleague introduce herself.
Hi everyone, I'm Brooke. I'm a third year student at Cardiff in midwifery.
Fantastic. So very shortly, we're going to start our presentation. I've got a little bit of information for you about the BMid programme at Cardiff. And then as we work through, if you'd like to type any questions for either me or for Brooke in the chat, when we finish the presentation, we can go through to answer some questions for you. Okay, I'm going to try and move my slides on. Phew, it's always glad it works. Okay, so you've joined the webinar because you're interested in midwifery and as a future midwife. Just to sort of put that in context for you. So as midwives, we're fully accountable as the lead professional for all women, birthing people and newborn infants, partners and families, which means that in a straightforward pregnancy with no complexities, the only professional that pregnant people need to see is the midwife. So we can plan care, we refer on as we need to different organisations and agencies. We deliver babies, we look after babies, mums and families postnatally. And then if complexities do arise, we work within the multidisciplinary team to work with consultant obstetricians or anaesthetists or GPs, family doctors or nurses or physios. So our involvement really in a pregnancy and birth is really, right in the middle of it. So we provide care based on the best possible evidence. So the information around pregnancy and childbirth is changing all the time. So part of our role and responsibility is to keep up to date with the current knowledge and the skills that we need to provide respectful and compassionate care, but also be able to convey that information to the women and birthing people so they can make decisions that are right for them based on the best possible evidence. And sometimes people might choose, having heard the evidence behind the decision they're making, to maybe do something different to that which most people do. And that's part of our role as well, to help organise that and help people feel supported in their choices. I've already explained that when complexities arise, midwives work as part of a bigger team. And we work all over the place. So midwives work in the hospital, on people's homes, in the community, in birth centres. We provide care wherever pregnant people happen to be. We can provide antenatal care before birth, care during birth. So that's the delivery part of it, although we try not to use that word, delivery, because babies aren't pizzas, and postnatal care, so care after the birth, for up to 6 weeks after the baby's born. Usually a bit sooner, we've discharged them from our care, but about 6 weeks. And we deliver all sorts of health promotion messages alongside the care that we provide. And we believe that as midwives, we're really powerful. We have a really important role to make connections with the people in our care. It's really unusual in health. In pregnancy is a normal life event. Nobody's poorly. It's just a normal life event. It's really powerful to be able to make connections with people and have 9 or 10 months of care alongside those people, so they get to know us as midwives really well. And those are the times that people really want to make changes, maybe to their health. They want to maybe try some health promotion techniques, or maybe they want to give up smoking, or maybe they want to eat more healthily, or maybe they want to exercise more alongside being pregnant. And we're really well placed in those situations to help support families do things like that. So I'm sure this isn't the only midwifery programme you're interested in, but why would you choose to apply to midwifery at Cardiff University? We've got a high student satisfaction. If you want to look at the NSS, the National Student Survey, it's an exit survey of our third year students coming up to graduation every year, and they give their opinions about how they found their experience at any organisation. It's a really interesting report if you're interested in how satisfied students are for any programme up and down the country. We're ranked one of the top programmes for midwifery in Wales. You've got really varied placements. So we've got 2 fantastic partner health boards, which I'll come on to in just a sec, with really modern maternity facilities. And you will have the opportunity to be in placements in both of those over the 3 years of the midwifery programme. 50% of your learning is done in theory, 50% is on placement when you organise it in blocks. So I'll show you a picture of that, what that looks like in a minute. Got a really interesting contemporary curriculum. We're always updating in line with evidence and what's happening in the culture of midwifery. I'll give you an example in a few minutes about some of the modules that we're running at the moment. You have an opportunity at the end of the 2nd year to go on a placement overseas if you want to. And Brooke had that fantastic experience over the summer, so she can tell us a bit about that in a minute. We've got a really experienced lecturing team. I won't tell you how old we are collectively between all of us, but it racks up a fair few years. We've got a wealth of experience. We love teaching. We're really privileged to do the job that we do. But we are particularly privileged because we have superb students at Cardiff University. We are so lucky to have colleagues and students such as Brooke. We work as a team. I can't teach if Brooke doesn't want to learn. I'm really proud of the standard of students we have in Cardiff, and it's a pleasure. You also have access to really modern, comfortable, well-lit, airy facilities and to be taught in, and also fantastic simulation facilities. And I'll show you a couple of pictures of that in a bit. All of our curriculum is guided by the Nursing and Midwifery Council standards. So we've designed our curriculum to make Cardiff graduates really midwifery ready, really future ready to take up a career in midwifery at the point that they finish the programme. We're also very privileged to be one of the 2 collaborating centres for midwifery development in the world. So Cardiff University has one, and there's another one in Chile. And with that connection, we're able to influence the future of global midwifery by the programmes that we run, by our insight and understanding as a lecturing team. We are able to help programmes in different countries, midwifery programmes, develop. And obviously, because we can do that, then as any student of Cardiff University gets to be part of that fantastic work as well. So typical offer, I've lifted this straight off the website, so if you want to have a look for your particular circumstance, our typical offer at A-level is ABB. Our BTEC is distinction merit, and we need 30 distinctions, 15 merits. We accept Welsh baccalaureates as one of the A-level options. There's variations for EPQ. There's all sorts of different combinations of things. So if you have something unusual, which often people do, then do have a look at our website, and there's a drop-down table and you can work out what you've got. Failing that, if you've got something so peculiar it's not on our website, you can email us at HCare Admissions and I will have a look at it individually for you. We do need to remind you that you still need your 5 GCSEs at C or above, including English or Welsh if you're first language Welsh, science and maths. Okay, so how will you learn? So we have face-to-face lectures, we have seminars, we've got group work, simulated skills, which means that every year of the programme we teach you something different in simulation. So all of the things you are likely to see in the clinical environment in the hospital or in the community, we've already had a practice through with the mannequins or with the equipment. So things like we teach you to take blood before you go on placement, knowing that you'll need to do that. Start learning how to do that in practice. Things like blood pressures and abdominal palpation, so feeling the pregnant abdomen to work out the lie of the baby. Anything that you're likely to see in practice, then we have a practice, we have a go in simulation. We've got a brilliant facility to do that. Sometimes you're learning with quizzes, lots of discussions. Nothing's really off limits in the way that we teach, so we try and keep it really current. Sometimes there's online sessions, but please be mindful of the fact that most of our teaching is done face to face. So you are expected as a student in Cardiff University to be present, to be in Cardiff, to be in your lectures when they're timetabled, and there's quite a lot of lectures timetabled. So on an average week, we expect you to have about 30 hours worth of lectures. So you're in most days, okay, when you're in a theory block. So do expect that. Anything that you miss, if you happen to be poorly and you can't attend for that day, you will be expected to do some retrieval work, which means that you've demonstrated that you've learned about the session that you've missed. Because as midwives, you can't not know stuff. You have to know everything to keep everybody safe. There's some self-directed study. There's time built into the timetable to give you some time to do some background reading or to catch up with something you might want to do some more work on. And some of your mandatory training is done as an e-learning program. So things like your the theory behind your manual handling, the theory behind taking blood, some things like that are as e-learning packages which are timetabled. So these are the hospital environments that you will be placed in. So the top picture is the top picture on my left, which probably will be your right, the one with the road in it and the crossing. That is the University Health Board in Mhrifysgol. That is a new build hospital on the outskirts of Cwmbran on the M4 corridor. The bottom picture with the trees in is the University Hospital of Wales. That's next to the campus that Cardiff University teaches midwifery on. And then the picture on the other side with the desk, that is a hospital called Ysbyty Ystrad. There's a birth centre there, and that is in part of an Mhrifysgol Health Board, a little bit further out of Cwmbran, up the valley. And all of those will be hospital-based placements for you over the 3 years that you're here. Then you'll have community placements and you'll have specialist placements as well. This is an example. I mentioned in my first slide that we teach in blocks. So what on earth are you talking about, Nicky Lacey? So in blocks mean that the pale blue tiles, there's quite a lot of pale blue tiles. They are your theory blocks. So in those blocks, you are based in lectures and seminars, the things I was explaining, you are timetabled. So those are your theory blocks. And then in between those, there's lots of different coloured tiles with PLE, this, that and the other on them. Those are your clinical placements. So you will spend those weeks of the programme in placement, either in an antenatal placement, in a postnatal placement, in a birth placement, in a community placement, and there's all sorts of other bits and pieces mixed in as well. Okay, I do need to be really clear to you that this is a 45-week programme. Okay, so you look at the little teeny tiny red bits on each row in each line. Those are the holidays. Okay, so those are the only time you're not in placement or in theory every year is 7 weeks of leave. Okay, so we can't move the leave sits where it sits on your timetable. And when you start midwifery at Cardiff, you will get a line plan like that, so you know what you're doing. But we can't be moving holidays around to suit people. Okay, so it sits where it sits. So you can see there's a Christmas holiday and an Easter holiday and a summer holiday. Okay, this isn't your exact, this is just an example I've mocked up so I could explain to you how it all fits together. So please don't think that this is, the dates are quite, I don't know if you can work out dates on this, but it's just an example for you to see what it looks like with 50% theory and 50% practice over the 3 years. So how will you be assessed? So you're undertaking a midwifery degree, an undergraduate honours degree, and you are doing a registrable qualification as a midwife alongside. So that's why there's such a lot in this programme. You'll be busy bees. How will we assess you? Well, what we've tried to do is do a little bit of something for everybody, for each learning style. You all have to do all of it, but we wanted everybody to have the opportunity to do something other than write an essay or do a presentation. So we really mixed it up. So some of our assessments are essays, some of them are report writing. We want this programme to be future proof. So when you qualify as midwives, you've got all the skills you need. Essay writing is a little part of midwifery, but report writing is a really useful skill. Synthesising information, bringing it down to the real essence, auditing outcomes is something that's really important in midwifery to keep us up to date. So we teach you how to write reports, and it's the way, one of our assessments. We've got practical exams, so we'll give you some equipment and give you a question and ask you how you're going to, what you're going to do, and show us how you do it. Some of us are better at doing things than they are about writing things, so there's practical assessments. We've got a multiple choice question paper in year 1. You will complete a medicines programme. We don't have numeracy in this programme, but we do complete Safe Medicate, which is a calculation programme about drug dosages and administration. So each year you'll do Safe Medicate. And then we've got midwifery practice exams, which are scenario based, and we give you an emergency scenario and ask you to identify what the emergency is and tell us your actions. There's a bit of something for everybody, but you all have to do all of it. Okay, I thought you might be bored, so I put some pictures in to entertain you. It's a very interactive programme. We've got the top slide, some students are learning how to do pulses on each other. The pictures with the silly hats are our midwives having achieved their 40 births. So over the 3 years of the programme, all midwifery undergraduate students need to set out certain requirements in order to be able to register as midwives. Facilitating 40 births is just one of those things. In the middle picture, we are practicing doing newborn baby checks. I think we're doing in that one. The picture with the 2 ladies and the certificate, there's lots and lots of opportunities to develop in this programme. That is a student who has been successful at winning an award to get some funding to run a study day. So she's taken it on her own bat to organise a study day. But it really interests her. That came off a programme she was doing over the summer. So that was her reward for that. We've got midwives on the end picture with a Welsh Government actually being part of a discussion with the Health Minister about the future of midwifery. You have opportunity to have time in theatre in the bottom picture. The very bottom left picture, the lady in the birth pool, that's one of our midwifery lecturers. Being a pregnant person, we were simulating water births at home, and we were thinking about how we get somebody out of the pool. And the very end picture is our lovely midwifery lecturing team. So I think I'm almost coming to an end now. So I'm just going to answer these questions as we go through, because often this is what you're going to ask me in the chat, but I'll just answer these. I can elaborate more if you need me to. I'm just going to have a quick check of the time. So I do ramble on. No, we're okay for time. Do you arrange your own placements? No, with the exception of your overseas placement. If you choose to do one, we will arrange your placements. You'll have experience in both health boards over the 3 years. So in Iron Bevan and Cardiff and Vale. Do expect to do a little bit of travelling between the placements and Cardiff if you're in an Iron Bevan Health Board, all possible on public transport if you don't have a car, but anything with public transport sometimes takes a bit longer, but all doable. Next question I'm going to answer is, can you apply this year because you don't want to start till next year because you're going on your travels? No, I'm afraid you can't. We have quite a few applicants, and we always have plenty of students to choose from to offer a place. So if you are wanting to take a gap year, you need to apply for a place when you're ready to start. So we're taking applicants now for September 2026. And you might be thinking, well, actually, I'm doing my A-levels now this year, and I'm going to be applying in September or from September 2026 for a place the next year. So please only apply in the year that you want to start, the academic year you want to start. Do you need midwifery related work experience? You don't. The way it works for us is you write a personal statement which is submitted with your UCAS application, and we read each of those applications between us. We take it in turns and we score them. So we appreciate you often can't get specifically midwifery work related work experience. However, you can have all sorts of different experiences that you are gaining transferable skills. So you work in McDonald's, you're used to giving customer service, you need to be patient, you need to listen to people, you need to be mindful of the fact that people have different communication abilities or different skills. All of that in your personal statement, you can relate to what it would be like to be a midwife. Qualifications, I've explained on the first slide I showed you. Do have a little check on the website that you have got the right stuff that we need. And if you've got anything unusual and you're not sure, pop us an email. Finance. We don't talk about finance this presentation. There are finance streams through Student Finance Wales and NHS Bursary. Polly in a minute will put that finance link in the chat so you can have a little look if you want to. Applications come through UCAS. They open at UCAS the end of September, and then as a midwifery team we shortlist them. We are looking for specific things, values-based things. So we're looking that you've got the right, we feel you've got the right attitude, you understand what midwives do and how midwives need to be compassionate and caring, but be able to talk to people and appreciate people's differences, people's preferences. So the personal statements come in, we shortlist them, and then the top scorers from the shortlisted personal statements are invited to interview. Interviews are online. We're interviewing, we did our first interview day last Thursday, and we'll interview right the way up now until March. And the interview will be 4 questions, always 4 questions, 3 or 4 questions, about something to do with midwifery, or how you've prepared, or why you want to be a midwife, and you'll be interviewed like that. And how many places? At the moment, I don't know. I'm anticipating about 60, maybe a few more. I'm given the amount of places I can offer by HEIW, who are our commissioners, and who say that we can run the course. I've got one more slide, I think. Yes, I have. One last slide. So I'm going to open the chat, open the floor to questions now, if there are any questions. And if you don't want to ask a question in the chat, or you think of something as a brainwave after, you can always pop it into an email to hcareadmissions@cardiff.ac.uk, and the questions eventually, after a couple of days, filter through to me, so I can answer any questions that you haven't had a chance to ask if you want me to. Okay, that's my last slide, I think, Polly. Shall I stop sharing now?
Yeah, perfect.
There we go. Here I am, and here's Brooke. Okay, any questions in the chat? Let's have a little look. Oh, it's thinking about it. Okay. So what would you say the ratio of happy positive to sad cases are in midwifery? Well, I'm going to answer this question. I'm going to hand over to Brooke, who might have a different perspective, or can bring you a student perspective.
Mm-hmm.
The majority of what we do is positive. We have we're very privileged to work as midwives. Sad things do happen, but part of our skill in midwifery is to monitor and to assess people's health and pregnancy, so we can intervene and provide specialist care when we need to sort of try and stop unusual things happening. So I'm kind of thinking by sad cases, you're thinking of poor outcomes for baby, or poor outcomes for mum. So just to reassure everybody, things like maternal deaths, so a mum or a pregnant person dying, is really, really unusual. So don't expect to see that. Sometimes it does happen, but it's really very, very unusual. And if you were to be around something like that happened, we have practice supervisors that work with you very, very closely, and we're very well connected with as a lecture team with your health board, so you will have lots of support, but please don't expect that, because that's really unusual. Things like stillbirths are still very unusual, but they do happen, and often there's no explanation or reason why that happens. So a pregnant person is pregnant, and something leads us to believe there's something not quite right, and on further investigation there's no fetal heartbeat. So most of those we know, we know when they come in labour, then actually that baby has already been compromised. So it's really very unusual for it to happen at the last minute, and I wouldn't expect to see that as a student. But other sad things happen, in terms of maybe sometimes babies don't stay with mum, or relationships between mum and dad break down, and those are sad, and those are sad situations to be around. But on the whole, it's very positive, and I'd say probably way up into the 90% things that are positive. What do you think? What do you think, Brooke?
I agree. I think in the 3 years, I've only seen two bad cases myself. But I think we can appreciate, because we are students, it's not nicer, but in a way it is, to experience it alongside someone else. So we can kind of prepare ourselves for when we are qualified. We can learn like things like the right documentation, which are things you don't think about, and the support you can give to women. But yeah, I agree. Primarily, it has been very positive, and those bad cases, we are taught how to support women, and they are really appreciative of the support we can give to them. So although it's a bad outcome, we do have a positive outcome on them.
And do you know, it sounds slightly strange, but the cases I've looked after I've been a midwife for 30 years, the ones that the outcomes haven't been what we've expected, or something sad has happened, they're the ones I really remember, because they're the ones you can make a massive difference to by using your fantastic empathy skills and listening, and really putting yourself in that person's situation. And those are the ones that really really sort of sit with me, and I think I feel really privileged to be able to have walked a bit of that journey with that person, even though I couldn't change the outcome. So on the whole, very positive. We've got lovely relationships with the people we work with in terms of the health, the practice supervisors. So when you're in placement, we don't just send you off wandering around the hospital. You are sent with a name, and you've made a connection with the practice supervisor, the midwife, the mentor, whatever you want to call them. We call them practice supervisors, but you go to a qualified midwife, and you work alongside them for the duration of your placements. What we do need to remember is midwifery is a 24-hour service. So when you're in placement, you will be following your practice supervisor's shift pattern. So lovely Brooke is now almost on Christmas holiday, but 3 weeks ago she was working weekend shifts and night shifts and day shifts, and following her practice supervisor on their shift pattern. So if you have commitments at home, you do need to be mindful of the fact that you have to be able to be available for the shifts that you are allocated to. Sometimes not with a massive amount of notice. Normally we give you a month's notice, but there's no such thing as set shifts on our programme. So you do need to be aware of the fact you have to have a plan in place for that. Is there just the one question, Polly? Is nothing else? No, nothing else has come into the
No, you might
the
need to
chat?
close it and open it again. There's a couple more have come through.
Oh, goodness me, I'm glad I asked. Okie dokie. Let's wait a little think to itself. Okie doke. Ruby's asking, how much involvement does a student have when it comes to an emergency that requires the aid of doctors? Does the main attention go to reassuring the mother? Well, the priority is the mother or the birthing person, absolutely, but you are working alongside a qualified midwife, whose part of her responsibility is to be looking after or looking out for you, making sure you feel safe and supported. When the emergency is actually happening, the priority is the mother or the birthing person. However, as soon as that situation is dealt with, part of your supervisor's responsibility is to debrief you, make sure you felt you understand what happened, what you could have done if you were doing anything, if you could if you needed any sort of talking to explain understand what happened, understand the theory behind what happened. You will, as midwives, be part of emergency situations. Part of what we teach, particularly in the second and third years, is lots of information about emergencies, because sometimes we are the only person there as midwives. So you get to sort of see it firsthand, and that's the best way to learn, even though it's scary when it's happening. You will become very, very skilled at managing these emergencies. What do you think, Brooke? You've probably been involved in some. So by emergencies, it tends to be things like somebody's bleeding, or somebody has a baby that's not quite being delivered, being born in quite the way we want it to. Maybe it's got its shoulders a bit stuck, or the baby not this isn't an emergency, but it's just a surprise sometimes. Sometimes babies are coming bottom first and we don't know to the last minute. So those sort of things that sort of happen as emergencies need to be quick in midwifery. What do you think, Brooke?
Yeah, I've seen a few, and the midwives they still get stuck in, so everyone works really well together. So the doctor might be I don't know, say if his shoulders are stuck, they'll pop the mum into the right position, and then the midwife will be supporting the mum, telling them what's happening, but also supporting the doctors to make sure that baby is coming out safely. They've got everything prepared if they do need to escalate anywhere. Yeah, and we kind of they work really well together. And then as a student, when an emergency arises, in my first year, I kind of just stood in the corner and was just watching everyone. But now I kind of get more involved and document for some people, or I'll grab some things from the trolley and pass it on to someone else. Yeah, but it all just comes with experience as you go further into the course.
Yeah. The first time you see anything that looks like it's moving a bit fast and it's like it's come off the telly, it does feel a bit, I wasn't expecting that. But that's our job as lecturers, but also with your practice supervisors, to sort of to debrief you so you actually understood what happened. But the first time it is a bit, oof, goodness me. But as Brooke now, as a nearly qualified midwife, she's on the home straight now. She can get involved and actually probably knows pretty much everything she needs to know. It's just practice now. Fantastic. Thanks, Brooke. Okay, so our next question is from Layla, who's asked, is there any particular research topics you'd ask about or want us to know about at an interview? Well, yes and no. We want you to just be interested in midwifery and just done a bit of reading. So watching One Born Every Minute isn't really enough preparation for coming to an interview, or even Call a Midwife. Much as I like Call a Midwife, it's not enough preparation. We want you to be looking at things that sort of just give you a bit of a background and an insight to what midwives do on a day-to-day basis. So things like looking at the Royal College of Midwives website, if there's any interesting things to read on there about different current affairs in midwifery. Things like the Nursing and Midwifery Council, they are our regulators. They are the people that will allow Brooke in a few months to join the midwifery register, to take off her lovely purple uniform and put on a grey uniform, become a registered midwife. So they've got interesting websites to look at, understanding what you need to know as a midwife, because there's far more to it than just delivering babies. Things like current affairs. About 2 or 3 years ago, there was a big report called the Embrace Report that was written. Well, it's written every 3 years actually, but this particular report was fascinating because it identified that women with brown or black skin had different outcomes for their birthing experience, for them and their babies, than somebody who was Caucasian skinned. So why is that? So things like that are interesting to read. We want you to be able to talk about something with interest when you come to midwifery. There's been something called the Ockenden Report a few years ago. There are the NICE guidelines, so the guidelines around midwifery. So anything interesting, you haven't got to read it in massive detail, just be aware of what's happening in midwifery, because if we say, have you read anything interesting recently, you've got something to say. So anything else you'd suggest in preparation for interview, Brooke? Cast your mind back.
Yeah, I think mostly what you've said, reading like the Embrace report and just new news in midwifery, really, and finding something that you're interested on, but also primarily just being yourself as well, and showing that you are a caring person and you can be empathetic and you can support people. And yeah, that's the basics of midwifery, is basically having conversations with people and supporting them.
Yeah.
Yeah, because sometimes I have 12.5 hour shifts where I just speak to a woman the whole time and she doesn't even have a baby. So
Yes, yeah, absolutely. Because it's a values-based interview. So we know that you're not midwives yet. We really don't expect your interview to have tons and tons of information. But what we expect you to have done is a little bit of background reading and really have thought about why you want to be a midwife. So rather than I like babies, well, great. But as Brooke said, sometimes you go for a whole shift and you didn't see a baby. Sometimes, so that's what we're looking at. We're looking at your qualities. We're looking at your things that interest you. What have you read about? What books have you read? And if you don't like reading, then watch YouTube stuff. Watch. Don't do dodgy TikTok things because they're not useful to anybody. But just think about how else could you gather information. If reading a book isn't your thing, just think about how else could you gather information. Alice is asking, how many people do you interview and how do the interviews work? So last year we interviewed 480. We did 480 interviews. We had about 800, 750 applicants. We did the shortlisting, like I explained to you, from the personal statement. Then the top scorers then came through to interview. We interviewed about 480 or 400, 450-ish. And then I offered my places out. I offered more places than I had because I like to stick to my grades. If I possibly can, I want people coming through with A, B, B at A levels or the equivalent. Okay, so I don't drop my grade. So I've got a lot of choice. Interviews are online, 4 questions, very straightforward questions, no trick questions. We just want you to be yourself. You'll have 1 or 2 interviewers, a bit like a Teams call like this. Sometimes it's 1 person and sometimes it's 2 people. So our third year students are going to be coming to help us interview this year because they know the qualities that they brought into midwifery and we know that they are great. So a lecturer plus another person sometimes, or sometimes just a lecturer interview. And I think there was one more question from Layla I spotted. When should you expect to hear back regarding an interview if you had acknowledgement of your application last week? Well, we're shortlisting all the time. I did a whole chunk of them today. We've got an interview day. We did one Thursday. We've got an interview day on the 6th of January and we've got one at the end of January. So we're trying to get through them as quick as we can. So hopefully it won't be too long, Layla. We really want to fill up our interview days as quick as possible because we don't want you to be hanging around because we know how stressful it is to be sort of just on hold waiting. So bear with us. If it was only last week, it might take a little bit longer. Probably give us 3 weeks or so. That said, it is Christmas. We have to wait for Santa to come. So it shouldn't be too long. But if you are waiting a little while, then you can pop us an email at the admissions email address and I can have a little look and see if I can find you. But you shouldn't be too long at all. Is that any more questions, Polly? Have I got to refresh and come back out? Ooh.
I think there is one that says, could you please talk more about what the scheme Only Cardiff and Chile do?
Oh yes, but it's not a scheme as such. It is a collaborating centre. So the WHO, the World Health Organization, looks for organisations like a university or a hospital or somewhere that has a particular skill at something, and they approach you. We've been approached by the World Health Organization to help them collaborate with developing midwifery curriculum and education in different countries. So this time last week, I was in Kazakhstan. I was presenting at a conference. I was a panel member at a conference because I'm the deputy director of the collaborating centre. But it means that we can use our expertise and knowledge as educators in the UK and using our resource as educators and Brooke's experience, for example, as a current student midwife, we can transfer that information and present it into different countries who don't have a midwifery curriculum or even a midwifery profession. Some places they just don't have midwifery as a profession. They just have nurses and doctors and they sort of muddle along between them. But that's the Collaborating Centre of Midwifery Development. So with our work with the Collaborating Centre, as students, one of our students was part of the Collaborating Centre as her overseas placement. She actually worked on a document for the Collaborating Centre. So that's what that's all about. Okay, have we got any more? Let's have a quick look. We're nearly out of time. Oh, I think we're going backwards on the questions now. Have I missed any? Polly, can you see any?
I think there is one has just come in to say, how soon can you expect to hear back after an interview?
It depends. Some places we are, in some instances, we're able to offer people a place, a conditional place pretty soon. Some people will release back into UCAS pretty soon. And then there's a little chunk of people in the middle, just depending on how we score the interviews and how you've done an interview. And we're trying to get them out quite quickly because we know that you need to know. So some people, I'm afraid, will hear almost straight away. I'm not afraid, I'm glad they hear straight away. Some people will be released back into interview because they haven't really been what we're looking for at Cardiff. And then there's a chunk of people. I've only done one interview day last week, so come January, I'm hoping to release a few more places. The good news is we keep places to sort of feed out through the interview cycle all the way through. So even right up until March, my last interview day is in March. I've still got places to offer. So it's not first come first served at all at Cardiff. It is, we really want the right people. So I'm sorry if you have to wait a little while and we're not quite as quick. But we're on it, and we will come back in touch with you as quick as we possibly can. But it shouldn't be too long. Okay. Any more? I think we're nearly done. Okay. Anything else you want to add, Brooke? We've got a couple of minutes before we get booted out.
There was one question from Ruby. She said, what does employment look like in Wales for midwifery after graduating?
Okay. So at the moment, we have streamlining in midwifery, and it's a process that there's quite a high possibility that you will be offered some hours of employment when you qualify. We're in a different situation to England, which work on a different process. At the moment, we're optimistic that there will be jobs. There's a high possibility of jobs for midwives in Wales on graduation. However, 3 years' time, I can't predict what's going to happen, but we hope that we've got a robust process. So what happens is a streamlining process. If you train in Wales, you are able to apply for the pool of jobs that are ring fenced for midwives that are trained in Wales, and your job matched into that. So September, all of the midwives that qualified and wanted a job in Wales were offered some hours in one of the health boards. How the future looks, I'm not absolutely sure, but it's a conversation we're having, so we feel quite confident about it at the moment. I think I'm going to have to say goodbye because I think we're going to be popped off in a couple of minutes. So thank you so much for your time in joining. Thank you, Brooke, for your insight and for being willing to come on with me. Thank you, Polly, for making it all work. If you do have questions and you haven't had a chance to ask them, pop them in an email to 8th Care admissions@cardiff.ac.uk and they will come through to me. Really hope that you are considering applying for midwifery at Cardiff. We have some open days coming up in the summer. I think we've got June open days, but keep an eye on our website and we will post the dates of those, and it'll be lovely to see you in person over our interview days to get to know you a little bit, and we can explain a bit more about the programme. Okay, thank you ever so much, everybody. It's been lovely not to quite meet you, but to be able to have a chat with you, and I hope everybody has a lovely evening and a happy Christmas. Thanks, everyone.